show, we're going to have a special guest with us again, Michael Isaacson of the Kane County Health Department. So if you got some comments, give them to me. Let's get them in. And questions, whatever, if you have some out there. We've tried to get this around today to tell people that Michael's going to be with us. So on this cold day, it was cold. I was out for a walk for just a few minutes. I know some of you have been doing more than that, so been out. It's not too warm. So here's Michael. We're going to bring our friend up here. Here's Michael. How you doing, Michael?
I'm excellent. How are you doing tonight, John?
I think pretty good, pretty good. As I was saying, it's a little cool one out there today. It's that wind, I think.
Yeah, you can feel it.
Yeah, it goes right through you almost. So I'm going to put out my welcome mat for Michael here again. So we're going to get right to that. And Michael, last time we talked about almost 3 weeks ago, things were, well, they were going up a little, but now we've seen some pretty good upticks here lately. I got some numbers I can throw up here. I'm going to throw up these. I do it on my website. I'm going to take down the two things here. I'm going to take that down. And I'm going to take down the bottom here, the scrolling for a moment. But you can see the Kane County numbers. Of course, this is for a 2-day data. So maybe we divide it in half, maybe. I mean, that's the way to look at it. Kane had 815 in 2 days. And that's over the weekend here. And we had 2 deaths. And you can see the state numbers were up there too at over 19,085. So we can divide them in half probably to get a 1-day idea. But I think we had 11,000 one day on cases in Illinois. So, but it's still steady uptick here. And what's your thoughts on where we're at with this type of stuff, with these numbers here, Michael?
Yeah, like you said, it's been pretty disappointing the last couple of weeks. Just within the last week, we've had over 100% increase in the number of cases that we've had. We had 1 day last week where we had the second highest single day total since January. And that's before vaccine was even available. So this is something that we really want to pay attention to. And we want to encourage people not only to continue telling people to go out and get vaccinated against COVID, because that is doing a good job keeping people from getting seriously ill and certainly protecting people from dying. But now we want to encourage people to go out and get booster shots as well. So if they had Pfizer or Moderna, we want them to go out and get their booster shot 6 months after they had their second dose. And if they had Johnson & Johnson, the recommendation is still for people to get a booster shot after 2 months. So most people would be eligible for that now. So we're seeing increases in people in the hospital as well. So you may hear people talking about, well, at least it's not as bad. And we're seeing people who are testing positive, but they're not as sick. It's true. A lot of people don't get that sick. But unfortunately, almost every day over the past month, we've seen an increase in the number of people hospitalized with COVID here in our region. So it's still something to take seriously. Getting the vaccine, wearing a mask when you're inside, if you can't be more than 6 feet away from other people, trying to keep some distance. And I know it's hard around the holidays, but just encouraging people to take whatever precautions they can to protect themselves and those around them.
Yeah, if there's some people out there who got questions, let's have them come in if you wish, or comments. So yeah, about the end of October, the Beacon News had an article about the 60505 vaccination story. At that time, it was 40% on the east side of Aurora, and it was the lowest in the county, I believe, by zip code. 40%. You got any updates on some of these numbers, would you say,
Yeah,
Michael?
yeah, we're still seeing in terms of people who are getting vaccinated for the first time, getting their first shots. It's been pretty slow over the past couple of months. So as the new age groups became eligible, we certainly saw an increase, which is fantastic because we are seeing spread in younger people in the community. So getting those 5 to 11-year-olds vaccinated has been great. But otherwise, we're kind of hitting up against a wall. And 60505 is one example, but we're also seeing in different parts of the community, different demographics where whether sometimes it's based on people's race, sometimes it's based on people's political views. There's really a variety of reasons why people aren't getting vaccinated. And again, as we've talked over the past months, we certainly respect people's opportunity to make an informed decision and weigh the pros and cons. But in terms of the spread that we're seeing now and the people who are being put at risk, there's simply nothing better for all of us than more people going out and getting vaccinated.
I think that's very, very true. And let's hope we can get the east side and other communities, get those numbers up. I've been done a little trying. I got to try more yet with some community leaders on that to have some vaccination clinics, or just, I don't know, just get the word out more yet. I don't know.
Absolutely. Yeah, and I can tell you, we've worked closely with churches, we've worked closely with the city,
Right.
we've worked closely with VNA to go and to host clinics in the community. We've worked with organizations such as Family Focus, who have staff that are residents of the neighborhoods, who are going
Right.
and talking to their friends and neighbors, and we're still struggling to get those numbers up in certain communities.
Yeah, we got to keep trying. And those groups, those are very good groups you mentioned, Family Focus and VNA and others too, are doing their job trying to build the community up. I know VNA has that homebound vaccination, I thought, too. So if you got some loved one who can't get out that easily, or maybe the work schedule is not great, but they'll help out with that. So we got down at the bottom of the screen, we got the VNA, and I also got the county website there. Now, you're doing Wednesday and Saturday at that Vax Center there in Batavia, right?
That is correct. Yep.
Yeah, so you can get your shots. I think the VNA too. Can you just do quote walk up or walk in or whatever you want to say?
We are allowing walk-ups for the adults, but if it's one of the younger 11 and younger, we do prefer, just so we can be prepared. We prefer
With the
for people to
vaccinations,
make
because they are different.
exactly.
Yeah, we got to do that. And I got my third shot, my booster shot a few weeks ago. I think maybe we talked about that last time, but I did have a little repercussion there for a day or so, but we got through that. And it's nice to see the young ones getting those vaccinations. I've seen a lot of comments on that. I don't know, the young ones really are, a lot of them are really excited about, getting that for their family and their parents and their grandparents, and so they can, have good holidays here.
Right.
And you see now, if you took a shot now, what's the Pfizer is how many weeks
21
after?
days in between shots.
How many days?
21
Okay,
for
so
3 weeks.
okay, you just missed Christmas here, but we get it soon. It'll be at least for the first of the year. You could start having that second, and then then it takes a few more days to get it fully in your stream there, to get it fully, get your full dose there, whatever you want to say.
Right. But yeah,
So
the sooner you start, the better. Definitely.
that's it. It's better now than later, and we don't want to see any laters here. I just,
I can tell you, John, it's been really fantastic at our clinic in Batavia. And I just want to really applaud the team at the health department who's running those clinics. I'm not directly involved, so I'm not patting myself on the back. I can just say we've got fantastic people who've been working very hard for almost a year now, or actually over almost a year. I guess we started December 18th of 2020. So they've been working really hard to get vaccine to people and doing a great job. And the parents and the families that we're talking to now at the clinic who are so excited because now they're in many cases they're able to get their final family member vaccinated. So maybe everybody in the family was vaccinated except for the 6-year-old. So people are just so thankful, and whether they're getting their shots from us or one of the pharmacies or the VNA or another clinic in the community, it's just really excellent to see people getting that protection.
it is very good. And I know our schools, the kids do get COVID, because I heard of a young man in my church they were quarantining in his school because of some incident. And we got to have good contact tracing here too. That now I remember a few times ago, are you still in need of tracers, or you got that down pretty good?
Yeah, we have a pretty good team who's up and trained and doing the investigations now. So I think we're in good shape with that. But unfortunately the darn volume keeps picking up. So if you look just with the statistics that you were showing, 800 new cases, that's 800 people for us to call and
Oh,
interview.
that's true.
All
Wow,
of their
800 is
contacts.
quite a
So,
bit.
yeah, it creates a tremendous amount of work, and then it's a lot of work for the people we contact. So it's really a pain for people when they have somebody in their family who's quarantined and may have to miss school.
Right.
So for us to be able to get people vaccinated so that they don't have to miss school, that makes life easier for everybody, certainly.
Yeah. Yeah. So we have our vaccinations. As I just threw that up about this. We have our different ones, Moderna and Pfizer and J&J. And so there. And does J&J have the third shot too now? I forgot.
It would be the second shot for
The
that.
second shot,
Yep.
but a booster shot.
Yep.
So
Yep.
they're all having boosters, and they all been what do we call it? They're not emergency anymore, right?
Well, some still are. So we're still transitioning through, and for different
Oh,
age
maybe
groups
that
as
young
well.
ones is that
Yeah.
way, right?
Right.
But the adults is not that.
Right.
Right.
And
Okay.
it's nice to see our numbers, even though it's been slow. We're still just looking here at the latest information from the CDC. Over 85% of our seniors are fully vaccinated, which
Yeah,
is
that
just
is good.
fantastic.
We got
So good
yeah,
news. For the 12 and over population, we're just over 71%. So that's good. I mean, it's not perfect. 30% of the population is a lot of people out there who are still unvaccinated. So even though I'm really happy to get up over 70%, as we look at all the people getting COVID in the community and unfortunately ending up in our hospitals, it's still a lot of people who aren't vaccinated. And then overall, if you look just at our whole population from birth on up, we're just over 60% of the population is fully vaccinated. So
right.
the numbers are slowly climbing, but it's taking time, definitely.
Yeah, the numbers are, and oh, the case level has picked up. We were at, maybe 8 cases per 100,000. Now we're at 44 or something like that on a 7-day average or something. And the state picked up too, of course. And this has happened basically since about the last time we talked, probably about the last month or more, and just no more than 6 weeks, probably 4
Right.
weeks, 6 weeks. And I think it really, last week, it just started to really climb. And I was wondering what your thought is on the Thanksgiving. Did that maybe have something to do with it?
I don't know. We're still pretty close to Thanksgiving, and it's interesting. There's a variety of things that play into this.
Right.
Certainly speculation as we get the drier weather, we get colder weather, so people are more indoors.
Right.
Last year, if you remember, we had our big spike that really came right on the heels of Halloween, and then it wasn't as big after Thanksgiving necessarily.
Okay.
So there's a lot of variables, I think, at play.
Yeah. Well, it just seemed like it maybe was Thanksgiving. I don't know, but it's been going up the last days here, the last week or so or more, really some good high numbers here.
Yeah.
And we got to get this under control if we really want everything to, quote, be open, and our masking, our social distancing. We got to watch out for large crowd events that are tight, especially indoors. And just so many things here that we got to watch. Now, here's the site to to get yourself an appointment with the county. And VNA, you can do that bottom of the screen, same idea. Set up an appointment and get in there. I don't know. I haven't looked. I don't know what Wednesday is offering there, but we got Wednesday and Saturday with the county, right?
That's correct. Yes.
So that could be. Here's their site that has all their information and more.
And
Kane
we try to keep an updated list of other places in the community where people can go. So maybe there's some place that's more convenient. Or if we're booked up on a certain day and somebody wants to get into a pharmacy, we list that information.
Yeah, I noticed you do have that on the site too, the pharmacies. And I've got mine a couple ways. I got mine first one through a pharmacy, and then the last one I did with the VNA because the pharmacy got booked up. Well, what happened was I wasn't feeling too good and had a fever from a tooth and other cold and everything. I just, the doctor advised just to hold off for a week or two on not getting the COVID shot. So then that place got all booked up. So, but I'm glad there are a lot of sites out there. So you can't really say that you can't find a shot. I really don't think you can say that, right, Michael?
No, that shouldn't be the case. I can't remember if we were talking last time. I got my booster. I live here in Aurora, and I called Osco at about 4 o'clock and got an appointment for 5:30 that evening.
Oh,
So,
really? That
and I
was
just,
really fast.
yeah, stopped by on my way home, and it was easy as could be.
Well, that's very convenient. And yeah, the several pharmacies are offering them. So, basically, I think all of them are. Well, maybe I'm misspeaking, but I think they
Yeah,
at least. But on the site there at the county, you have all those and where they're at. Oh, maybe not everyone offers that. Some I think Jewel Osco is pretty good on that. I had a friend who's done Jewel Osco too. So that's very good. And so we just got to keep in there for the county and everybody, for our country, for everybody in the next days here. Any thoughts you want to leave us with here or build on here, Michael?
Yeah, I think, one thing that certainly has been getting a lot of attention in the news is the new
Oh, we didn't talk about that yet.
Omicron variant
Yeah,
coming
right.
out of South Africa. And we're tentatively optimistic, very tentatively, that perhaps it won't be as severe as was originally feared. But it's kind of the theme for the pandemic is wait and see. We need a little more information before we can say too much. Last I saw, had been identified in about 17 states so far, not Illinois yet, at least in the last information that I'd referenced. But we certainly have Illinois residents who've been around people who have the variant. And because we don't live in a little bubble here, we fully expect that we are going to see cases coming into our area. But as you mentioned, with the cases going up so much with the Delta variant, and that's what 99% of our cases right now are Delta variant, and that's bad enough. So I think not to get distracted with what may be coming next. because that doesn't change what we're doing necessarily. We know what works. We know getting vaccinated is going to keep people from getting seriously ill. We know that wearing a mask is going to dramatically reduce the chance that you pass the virus on to someone else. And we know that anytime we can, stay a little bit more physically distant, that's going to reduce the chances of passing it to somebody. So even though it's the same old boring stuff that people are really tired of talking about, that's what works. That's what we are encouraging people to do. And it's even more important now coming into the holidays. And unfortunately, we keep seeing stories about, joyous events, whether it's a wedding or a holiday get together, where then family members end up losing their lives a few weeks later. So even though we want to kind of just forget that this is going on, we can't. And so just really encourage people to just, anything you can do in your family gatherings to make it safe for people, please take those extra steps.
Yes, that's what we got to do, and really be cautious and just think ahead here. And I want to use a quote from the Pope Francis: "Vaccinations and doing these things are an act of love." So we got to show love to others here. That's what we're trying to do here. Michael, I want to ask you. I just thought of one more question here, and that to find out if Omicron's here, how does that work? How do we catch that? How would we know if it's in Kane County? Is that through what type of screen? Is this screening that would be done, and how often you do that, or what's the story on that? How would we know if we have Omicron in Kane County?
Yeah, no, that's a great question. So we're part of a national lab system here in Illinois. So there's a certain percentage of all samples they get forwarded on to get additional testing where they can actually see what type of the virus it is, and so we can determine different variants and how many of them and which ones may be circulating in a specific community. So it's all done with just random sampling of our cases that come in.
So our labs that do the what's it PCR?
PCR, yes, that's one
Yeah,
way.
and
Mhm.
that would be the one that would. That's how you would catch it. It's not that what's the other one called? I had
Like
the other.
antigen testing,
What now?
antigen
Yeah,
testing.
I had antigen, but that probably
Mhm.
wouldn't do that, would it?
No, and it's actually even more in depth than that when they really get in and look specifically, and you get into things with different spikes on the proteins and different things that maybe you've seen some things on the news about whether or not certain tests will even be able to detect it. So the good news is it's almost 2022, and our scientific capability is pretty miraculous. So the experts in the lab are able to collect that, and certainly kudos to the folks in South Africa who first identified it, so
Right.
that the rest of the world would know to be on the lookout. So we're living in, even though it's not fun to be living in the time of COVID, we're at a good time in history, at least, where we have the technology available to us to be able to find these things.
Yeah, and one other thing, if the Omicron is a bad baby or bad kid, I think, am I not correct that they basically said they can adjust the what's it, RMA?
RNA vaccine, sure.
Yeah, they could adjust those. Probably the Johnson could too, but right? They probably could make some slight adjustment, right?
Yeah, and it's for us. It's really too early to tell if we even need
Right.
to
We
do
don't
anything like
know.
that. Right.
But I mean, that's the good thing about, you were just mentioning about science. So we know we could make an adjustment if we have to make an adjustment. But right now, the shots are being very effective, and so just keep moving on that front. Get your friends, your neighbors, your loved ones, get them to a vaccination. And
That's the
like we
key.
said, the older folks have somewhat better, but there's still a percentage of them too. Maybe it's 10%. I forgot the
Mhm.
number I had in front. Uh, but totally, it's about 60 in the county, I think fully, is that right? Or is it less? 60 fully vaccinated?
60% fully, yeah, almost 61% fully vaccinated.
Yeah. Then it's higher for the older 65 and above, but there's still a group, I think it was like 86 or something have fully vaccinated. So there's still, and maybe another 90 or 90 something had one shot, but there's still, 5-10% at least of older folks even. And of course, our younger ones, we just got to start getting them more vaccinated, right, Michael?
Absolutely. That's the key.
Yes. So thank you very much for the updates here. We're moving ahead here in the county and we're keeping ahead of it here. And Michael and the staff there are doing they're watching this and just being a source for our protection. So remember the places down at the bottom of the screen there. And so I just want to say, I want to thank Michael for being with me. And I told Michael we were going to talk about organs, and I forgot. Just one quick thing: if you need a family organ, I mean, this is a playing organ. It's not. I got one right here. See that? That's it. But it's a Wurlitzer organ, so just let me know if you need that at John at XPIN News. So that's my quick organ transplant. That's my organ transplant. Well, that's my bad humor there, I think. But anyway, so I thank Michael for coming by here again, and he's been a blessing for me and the county, I know. And we just thank him for coming by. And on, excuse me, on Wednesday, we're going to have a friend, Captain Joaquin Rango is going to talk about the Salvation Army and how they're doing with their kettle program and just what they're doing this Christmas time. And so that'll be on Wednesday. So again, thank you, Michael, for coming by and just taking time from your schedule to be with me and the audience here. Thank you, Michael.
Great. Thank you. Always a pleasure, John.
Okay. Well, we'll see you next time, everybody. And again, thank you, Michael. God bless. And bye-bye now. Bye-bye.